Radiation-induced fibrosis is a very undesirable side effect of breast cancer treatment or any cancer treatment that unfortunately many patients can experience. Now, radiation fibrosis is actually a scarring of the treated tissue that decreases the elasticity of the soft tissue involved. So symptoms can include tightening of the skin and the underlying tissue, and that causes pain, tightness, muscle spasms, decreased range of motion, and impairment of the underlying nerves and lymphatics in that tissue. And while there are many great stretches and exercise routines that are known to benefit this patient population, there is a long-standing controversy over manual therapy or hands-on techniques in the treatment of radiation fibrosis. There are many therapists who were once taught to never touch radiated skin, and I was never taught that, so it's interesting to see the difference. Now, today's case study is going to look not just at hands-on treatment, but deep friction massage in the treatment of this radiation-induced fibrosis in a breast cancer patient. Let's see what the results say. My name is Lisa Sylvestri. I'm a physical therapist and a certified lymphedema therapist, and my goal is to make us all lymph smart. So in this case study, we have a 57-year-old female who was in otherwise good physical condition with a moderate activity level prior to her diagnosis. Now, she underwent a lumpectomy and sentinel lymph node biopsy, as well as radiation. That caused immediate pain and reddening, as well as an internal burning sensation. But 3 months later, she began to present with cording, lymphatic disruption along her incision, and significant muscle spasms around her left scapula or shoulder blade and her rib cage and the small muscles within it. These spasms were occurring once or twice a week, with resultant difficulty breathing and moving, and these spasms were not responding to any stretching, and they were occurring at rest, not just during activity. So this case study is important because there are many clinicians who still believe that we should never ever put our hands on radiated tissue. And while I have always worked over radiated tissue, I have been tentative to perform deep massage techniques. Now, deep friction is deep pressure that penetrates well past the superficial layer of the muscles as well as the fascial layers in the involved tissue. This case study looked at 7 treatments separated by 28 days each. Each treatment session was 60 minutes with a gentle warm-up followed by deep friction massage to the entire affected area. Now, detailed strokes and information about the treatment itself can be read in this case study, but I think it's more important to talk about the results. So following the very first treatment, there was a mild inflammatory response that this patient experienced with redness and a little bit of irritation, but no muscle spasms for the following 28-day period. Over the next 3 treatment sessions, so for the first 4, she did experience some intermittent muscle spasms. However, she stopped having any spasms following just the 4th treatment. Now, of course, this is just one case study, but I do believe there's enough evidence to attempt deeper techniques when warranted and if the patient tolerates it in radiated tissue. There are also a number of studies that are posted below looking at deep tissue work in radiation fibrosis in patients with head and neck cancers. So it's all of this information together that should give therapists the confidence to perform hands-on treatment, sometimes deeper treatment, to improve radiation fibrosis in the affected tissue and area. I hope more therapists will be open to reading this study and performing work on the area to help patients reduce pain and improve function. Thanks for joining me today. If you enjoyed this video, please like, share, and subscribe in order to get and to stay lymph smart.